A man in his 70s is the first to die with COVID-19 from Knox County. Overall, 95 Mainers have died with the virus. Today, the Maine CDC reports there were 53 more recoveries and 41 new cases. The number of active cases dropped by 13. Maine also saw an increase of 34 confirmed cases. That's the largest daily increase so far this week.
Once a week, the Maine CDC releases data about the state's positivity rate, and that's important information. Today was that day, and it reveals another step in the right direction. News Center Maine's Don Carrigan joins us now to break down the numbers. Don?
That's right, Pat. Step by step, one of the things we've learned over the past 3 months of this pandemic is that part of it is about understanding numbers. As you said, each week, Dr. Shah says they look at what's called the positivity rate, basically the percentage of all the tests that have been done compared to the number of positive tests overall. And he says that for the first time so far in this pandemic, the positivity rate has dropped below 5%, just slightly, but still below. He says having that gives them a better understanding of the outbreak and also helps them have confidence. The number of cases gives a good idea of how widespread the virus really is. Also, that number is well below the rest of the Northeast except for Vermont.
It tells us, among other things, whether the net that we are casting with our testing is broad enough. According to many authorities, including the World Health Organization, as well as the US CDC, states should be looking to get the positivity rate as low as possible. Some say below 10%, some say below 5%. In either event, we're there. We've still got more work to do ahead of us. But if we take a look at what we saw in those tests that were just done in the past week, we see that we are heading in the right direction.
Now, Dr. Shah said that last week, statewide, there were 9,090 COVID-19 tests that were done, and 319 of them came out positive. And he says that's also a good sign because that particular percentage is also continuing to drop. Now, despite all that, Dr. Shah said they do need to have more testing done. He said the CDC is actively working on a plan now to expand the testing, and they're not quite ready to announce it yet, but he says it will include hospitals and also hope to expand testing in rural hospitals. No mention of whether they might also look to commercial laboratories to help expand testing. Pat and Lindsay, back to you.
And no, cats do not need to be tested for this, but thanks.